And now we will discuss the humerus that is known as Stylopodium single bony element. This is humerus. Humerus is the largest bone in the forelimb of ox. It connects the scapula proximal to the radius and ulna distally. It is a weight-bearing bone movement facilitating the bone, important for the muscle attachment, joint formation and locomotion. Location it is located between the scapula and radius and ulna. This is the humerus position. The proximal end is directly dorsocoronally articulating with the glenoid cavity. This is making the shoulder joint. The shaft runs obliquely downward and forward. The distal end is broad and articulate with the radius and ulna, forming the elbow joint. Here they are forming elbow joint. Proximities and shaft of the humerus. Proximal extremity articulate with the scapula at the glenoid cavity, contain greater tubercle, lesser tubercle, and bicipital groove. Tubercle of humerus include greater tubercle from this side, and then lesser tubercle located medially to the head, provide attachment for the subscapularis muscles, and intermediate tubercle, and this is the unique feature of ox. A prominent structure within the bicipital groove play a crucial role in guiding the bicep brachii tendon. Bicipital groove, that is also known as intertubercular groove, lies between the greater and lesser tubercles, and then we have surgical neck of the humerus located just below the tubercle, marking and transition to the shaft across a common site for future fractures due to the stress, and this is the surgical neck. Shaft of the humerus. The shaft is elongated, slightly curved, featuring lateral surface, medial surface, and cranial surface. Lateral surface contains the deltoid tuberosity for deltoid muscles attachment. Medial surface contains teres major tubercle, where the teres major muscles inserts. The crocobranchial muscles are also attached at the medial surface of the humerus. The cranial surface includes the brachial groove, a shallow depression for the passage of the brachial muscles. Caudal surface provide attachment for the tricep brachii muscles responsible for the ball elbow extension. Nutrient foramen is typically in the middle third of the shaft near the musculospiral groove. It is this area. And musculospiral groove is also known as radial groove, located in the caudolateral aspect of the shaft, a passage for the radial nerve and brachial artery. Now distal end. Articulate with the radius and ulna at the elbow joint, contain the condyles, epicondyles, and fossas. The condyles of the humerus located in the distal end forming the elbow joint divide into two parts: trochlea, that is the medial condyle, articulates with the ulna; capitulum, lateral condyle, articulates with the radius; and epicondyle, medial and lateral, serve as the attachment point for the flexor and extensor muscles of the forelimb. Olecranial fossa. Olecranial fossa located in the caudal surface of the humerus accommodate the olecranial process of the ulna during elbow extension. Radial fossa is located in the cranial surface and receives the head of the this is head of. Now muscles of the humerus. Extensor muscles of shoulder joint are the supraspinated which extend and stabilize the humerus. Flexor of the shoulder joint are the infraspinated that flexes and stabilizes. The deltoid muscles that help only in flexes. Teres major help in the flexes and rotates medially. Teres minor assists in the flexation only. Extensors of the elbow joint are the tricep brachii that are the main extensors, and enconius assist in the extension, and flexors of the elbow joint are bicep brachii flexes elbow and extends shoulder, and brachial flexes elbow only. And now we will discuss the radius and ulna, that is also known as zygopodium, which means two bony elements. The zygopodium is the middle segment of the forelimb consisting the radius and ulna and oxen. These bones are completely fused, preventing the rotational movements such as supination and pronation. The adaptation provides the stabilization and strength, making it ideal for the weight-bearing locomotion. General structure of radius and ulna. The radius and ulna and oxens are long bones that are completely fused except at the proximal extremity. They are completely, not completely, but somehow divided at the proximal extremity. The radius is the dominant weight-bearing bone, while it is reduced and mainly provides support at the elbow joint. Radius and ulna are divided into three main parts: proximal extremity, distal extremity, and shaft. Proximal extremity of radius include the radial head, flattened and widened, forming a concave articular surface, contain fovae capitis radii, which articulate with the condyle of the humerus to form the elbow joint. Then radial tuberosity located in the dorsomedially provide insertion for the bicep brachii muscles, which help the forelimb inflexation. Ulna, olecranial process, a large prominent structure forming the point of elbow, provide attachment for the tricep brachii muscles which extend the forelimb, and then trochlear notch, a deep concavity in the ulna that articulate with the humerus, help in the hinge-like elbow joint, and then conio process, a beak-shaped projection extending cranially from the trochlear notch, fit in the olecranial fossa of the humerus during the extension, ensuring the joint stability. Coracoid process, lateral and medial bony projection at the base of the trochlear notch provide additional articulation with the radius, stabilizing the elbow joint shaft. The shaft of the radius and ulna is fused, making the radius dominant bone in oxen. And now radius, shaft of the radius, cranial surface smooth and concave, convex. Distally, it grooves for extensor tendon, and caudal surface is roughed surface for the muscle attachment and fused with the ulna in oxen. Lateral and medial surfaces. The medial surface is not covered by muscles, making it easily pliable. The lateral surface provided attachment for the ligaments, and the ulna, the interosseous space is absent in oxen due to the complete fusion of the radius and ulna. In carnivores and pigs, this space allowed limited movement, and nutrient foramen located in the caudal